Hi, I want to talk to you today a little bit about chest pain. It's obviously something that concerns a lot of patients, and I wanted just to clarify some of the cardiac causes of chest pain, and also just to chat to you a little bit about what it could be, how people manage it, and what investigations people do. So cardiac chest pain, the classical definition of chest pain is usually related to something called angina, which is when the arteries in the heart become blocked or narrowed, and over a period of time they can cause discomfort to the patient. And the symptoms can be quite varied. Sometimes it can be central crushing chest pain going down the arm. Sometimes it can be more subtle forms of breathlessness or chest tightness. All of these things could be related to a cardiac problem, and the first thing to say is that if you do have chest pain, if anybody has chest pain which lasts more than about 15 minutes, they should seek medical advice immediately. For those patients who do get problems with discomfort and they want to see a cardiologist, the sorts of investigations that they'll do are a number of things. First of all, an ECG, just to get a snapshot of what the electrical activity of the heart is and what that could be, to look for any changes that could be associated with angina, which is the major cardiac cause of chest pain. There are other causes which could be non-cardiac, and your cardiologist would help you to define which one it is. But in a series of tests, they may want to do an echocardiogram, which is a test to look at the structure and the function of the heart. And sometimes you can see bits of the heart not moving so well on a echocardiogram, and that can help you define what's going on. There are tests to look for something called ischemia, in other words, to test whether or not there's a lack of blood supply to the heart. There are a number of different tests, ranging from a special type of echo to something called a myocardial perfusion scan, and of course things like a coronary angiogram, which are tests which is a bit more invasive, which involves putting dye into the coronary arteries to look at the outline of the artery to see if it's blocked or not. But these sorts of tests are done and discussed with you as to what would be the best thing for you as that particular patient. In terms of treatment strategies, if it does turn out to be a heart problem in terms of blockages of the arteries, then there are a number of things they can do, including giving medication, even sometimes considering something called an angioplasty and stent insertion, which is to put a stent inside the artery, where in some patients, a very small percentage of patients, thinking about bypass surgery. But I think that to summarise, there are a number of different options for you. But the first thing is to define whether it is related to a heart problem, and then to investigate that, and then to decide on a management strategy.